So let us discuss the indicator of the health in India in comparison with the other countries. As the table given 8.4, it is report about the 2005 that what is the infant mortality rate, what is the under 5 internal mortality rate, birth by skilled attendant, full immunized, health expenditure as percentage of GDP, government share of total expenditure, government health spending to the government spending percentage, per capita spending in the international dollars. So the comparison is given between the India, China, USA, and Sri Lanka. You can say that why we are going so far. Previously, we have seen the in our country why the government has done the lockdown because they don't have the infrastructure to fight with the against the corona. So this is the COVID-19. They required ventilators, medicines, and all that thing. For that, they don't have such type of facility. So that is why they have done the lockdown at that time to develop the some health facility so they can fight with them. So this is the condition of our country. We don't have the basic facility. You can say like that. So it is well known fact that India has the second largest populated country in the world after the China, but we are investing very less percentage of our GDP on the health. India has about 70% of the world population, but it bears the fighting 20% of the global burden of the diseases. And every year around 5 lakhs or to 5 lakh to 8 lakh children died by the waterborne diseases, and the danger of AIDS is in the also looming a large. Malnutrition and inadequate supply of vaccines leads to death of the 2.2 million children every year. At present, less than 20% of population utilities public health facilities, and only 38% of the PHCs have been required number of the doctors and the insufficient stocks of the medicines. So we required a proper infrastructure in the health facility because it is a very important part of our aspect. Now we will discuss this is the condition of the general we can talk about when we are going through individually we are talking about the rural and the urban or the rich and the poor. So it is the condition is more deteriorous than that. People living in the rural areas do not have a sufficient health facility. This lead to them in the difference in the health of status of people. 70% of India's population in the rural areas, but only 20% of the total hospitals and 50% of total dispensaries are located in the rural area. After then, the government employees are not going to the rural areas. They take a leave or they are not going. They are doing practice in the city only. So these are the very deteriorous condition. There are only 0.36 hospital for even every 1 lakh people in the rural areas, while the urban areas have 3.6 hospitals for the same number of people. So that is why you can see that the most of the hospitals, according to their income level, people you have seen the rural peoples in the hospitals. The person those who don't have the money, they are going to the government hospitals. You will see they are just moving here and there. They put their things everywhere. They are seated there and coming for the curing for the diseases with their relatives. And in the other hospitals also you can see the population of the rural because we do in the rural areas there is no health facility. You can say it's a no, not a many, very less, but it's a no because sometimes they didn't get the basic facility also there. If someone get accident, they don't have first aid facilities also in the rural area. So what is this? Village have to access a special multi hospitals, Medicare, because the population there, the population is more, the people are not properly educated, so they require more health facility if they are there only. So it will be helpful to them, na? But they don't have. So there is a sharp divided between the urban and the rural healthcare in India. If we continue to ignore this deeping divided, we run the risk of the threatening of the social economic foundation of our country, and that is happening nowadays. Now we will discuss about the women's health. Women constitute about the half of the total population in India. They suffer many disadvantages as compared to men in the area of education, participation in the economy, activities, and healthcare also. The child sex ratio declined from the 927 in 2001 to 914 in 2011. It indicates growing indication of the females 40 in the country. Around 3 lakh girls below the 15 year of age are not only married but have already born a child at least once. More than 50% of married women between the age of group 15 to 49 have anemic and nutritional anemic caused by the iron deficiency, which has contributed to the 19% of the maternal deaths. Abortions are also the major cause of maternal morbidity and mortality in India. In order to provide the basic health care to all, accessibility and affordability need to be the integrator to our basic health infrastructure. It is important to create awareness on health and hygiene and provide the efficient, efficient medical system to them. So, in the end, as the conclusion, we can say critical assessment of the health. I will divide it into some parts. Before that, I want to say that health is a basic human right, and we have to be get all the citizen can get the better health facility if and that is with the help of the government only. You can say the public health services should be better, should be good, and that is our right. So here, in the end, I will divided the infrastructure facility in some parts. That's the inequality distribution of the health services in our country. 70% of population was living in the rural areas, and they are getting only 20% of the infrastructure, health infrastructure, and this discrimination is very different, and this is very bad. Communicable diseases, increasing attention and urgently need to for prevention of the communicable diseases like AIDS, HIV, SARS, or now a COVID-19. So they government have to take the effective control to effective measures to control all these things. Poor sanitation facility, as we know, the sanitation facility, sanitation condition is a more cause of the diseases. So government in last 10 years, government has do many things in this area, but not you can say the satisfactory. So they have to be take the proper improvement in sanitation facility and immediately need for the good health of the people. Lack of manpower in these areas, in the medical areas, less pupils are there, less doctors are there. So more manpower required to come out to do the thing. Widespread malnutrition poses to the major threat of the life, especially in the case of a children, infant children. So for government, this has to take the very seriously. And first of all, they have to take, they have to try to eradicate this thing. Next is the role of the private sector. The private sector is a successful providing adequate structure of the health facility, but there is rates are very high. There is a very much you can say they are taking money to the people. So it should be avoided by government have take some policies. They have to take some steps, serious steps to overcome these deficiencies. So it is very important for us. So structure essential for economic development. Infrastructure act as a supporting system. It directly influences all economic activities by increasing the productivity of the factor in the production and improving the quality of the life. So after the economic reforms of the 1991, various concessions and incentives are provided to the private sector and foreign investor in order to attach them with the investing in the infrastructure facilities. So the government will helpful to make the infrastructure better.